Welcome back. If you suffer from spider or varicose veins, trying to hide them can be a whole lot of work, especially if you live in Texas in the summer. But there is a fix, and Dr. Robert Thompson, he is a board-certified vascular surgeon with Vein Tech. He is here to tell us so much more, along with Randy Clayton, who is one of your patients who recently had a procedure done on his varicose vein situation, right? Which was very painful for you, Randy.
Yes, it was very painful. I had actually 3 different areas on my leg and 3 different operations. And it gradually just gets worse and worse, and you wake up one day and you look at your leg and say, this leg is like 1.5 inches bigger than the other one.
Wow.
And my wife's saying, you need to go see a doctor.
Honey, you probably should not be putting this off any longer. And so then he came to see you.
He did.
And what did you do for Randy?
Well, we did a combination of a couple of procedures. One is called a laser ablation, where we actually remove the vein that's causing the problem. It's the large vein inside the thigh that supplies the bulging veins. That can be done in about an hour in the office with local anesthetic, and then we remove the smaller ones later in the secondary procedure.
So here's the before and then after the procedure. That looks very painful, Randy, the before. What were you feeling when you went to see Dr. Thompson? What was your leg feeling like?
Oh, I'd wake up in the middle of the night, it'd be throbbing, it'd be itching, you could feel it, just feel like it had a fever on it. And it's like, you know, my wife said, it's a guy thing. Why do you guys put it off for so long?
Why do you do that?
It's a guy thing. We can't help it. You know, we're wired differently, I guess.
I get it. I do get that. But Dr. Thompson, a lot of people associate varicose veins, spider veins, with women, but it's a problem across the board.
Yes, about 40% of women, but actually 15 to 20% of men will get varicose veins over their lifetime.
What causes varicose veins?
With men, it tends to be more of a lifestyle issue and some heredity, retail workers, nurses, doctors, salesmen, things like that. With women, it is a lot associated with childbirth. The pregnancies make your veins dilate, and also the heredity parts as well.
One of those wonderful things about childbirth. Just one more thing to add in. So how are you feeling now, Randy? Because you're not even a month out, but I think you skipped over here to get in your chair.
Oh yeah, I feel good. I feel good, yeah. Had a couple of the surgeries done. I went down in July. It was scuba diving in the Bahamas, and no problems.
Good to go. Good to go. Okay, so that is the varicose veins. You had the varicose veins. Now, there's also spider veins, which I think for most women, they just don't like the way they look. Right, especially if you want to wear shorts or a dress, or you want to show some thigh, you don't want to be seeing those spider veins. So there are ways to treat those as well, correct?
Right, the spider veins are not going to be a health issue, but they're more cosmetic, and they can be treated with what's called injection sclerotherapy, which is where we inject a small needle into the vein with chemical that makes the vein just shrink. And
so you do that, and then that vein will never come back.
Correct. We can get about 80 to 90% clearance with your treatment. Occasionally you'll get some in other places, but those veins that we sclerose usually do not come back.
And then what is that procedure like? Downtime? Do you have to take a day off of work?
No, none of these procedures have any downtime. They're all designed to be in and out, hour or less, and back to work the same day or the next day.
Now, when should people come and see you? I know Randy said he waited too long. His wife told him you need to go and see Dr. Thompson. But if people are suffering from varicose veins, how soon should they make an appointment with you?
Oh, with the large varicose veins, pain, bleeding, blood clots, any kind of complication early, you start seeing some discoloration of the skin, that's when it's time to come in.
And you had mentioned earlier that the spider veins, they're not so much of a health risk, but the varicose, if left untreated, what could happen?
Yeah, they can lead to blood clots, to bleeding, to actually skin ulcers long term, and chronic pain.
And then, of course, they just don't look really pretty. So, Randy, you wanted to show off those gams, right?
I want to have my sexy legs back again.
Of course you did. Of course you did. Well, here's what is so wonderful. If people are suffering, if they're thinking, gosh, I don't know where to go, I have this varicose vein, I'm in pain, or I have these spider veins, and I'm just uncomfortable with the way they look, they can come and see you, and you can take care of whatever it is that they're dealing with.
Everything will be done in the office, in and out, with no time down.
Good deal. And you have 2 locations, but before we give everyone all of the information on Vein Tech, you have a special offer that we want to tell our viewers about. So for the first 10 callers, you will get $100 off any cosmetic treatment. You just have to give them a call, 210-614-7467, and they will honor that. And they've got 2 locations to choose from if you need to set up a consultation to go see one of the wonderful doctors like Dr. Thompson. You can go to their first location at the Medical Center, and their second location is located over at Stone Oak. Their website, veintech.com. Thank you for being here. Thanks for sharing your story, Randy.
Thank you.
Thank you.
All right, guys, have a great week.